Blood pressure is the pressure exerted by the circulating blood on the walls of the blood vessels. Measuring blood pressure is a good way to check on a person's health, as it indicates the flow of the blood to the various organs. During each heartbeat, blood pressure varies between maximum pressure, known as systolic pressure, and minimum pressure, known as diastolic pressure. Blood pressure is usually expressed as maximum pressure over minimum pressure. For example, 140 by 100. Normal blood pressure for a healthy adult is between 110 by 65 and 140 by 90. Low blood pressure indicates that blood flow to the organs is not adequate, whereas higher blood pressure can cause damage to some sensitive organs like the kidneys. Any abnormality in the range of blood pressure needs medical attention. Blood pressure is measured using sphygmomanometers or the BP meter. The BP meter comprises of a pressure cuff which is wrapped around the arm of the patient. The pressure cuff is attached to the hand bulb. The hand bulb pumps air into the pressure cuff. A release value on the hand bulb controls the air pumped into the cuff. The pressure cuff is attached to the mercury gauge through rubber tubing. The mercury level keeps rising as the hand bulb pumps air into the pressure cuff. The BP meter is used along with the stethoscope, which is used to hear sounds that are generated in the vessels as the blood flows. The drum of the stethoscope is placed under the pressure cuff on the arm. Let us now observe how the blood pressure is measured. The patient is relaxed and is comfortably positioned on the bed. The patient extends the arm. The cuff of the BP meter is wrapped around the patient's upper arm. The drum of the stethoscope is placed under the pressure cuff. The sounds of the blood flow are heard when the drum is placed. Now, the hand bulb is used to inflate the cuff to create maximum pressure. This is indicated in the mercury gauge by the rise in the level of mercury. The doctor inflates the pressure cuff until the sounds of blood flow stop. Now, the pressure cuff is deflated by using the release valve of the hand bulb, and the pressure drop is indicated by the mercury level. The reading of the mercury level is noted when the first sound is heard on the stethoscope. The pressure cuff is deflated until the normal blood flow sounds are heard. The reading of the mercury level is noted when the blood flow sounds are heard normally. The pressure cuff is removed from the arm of the patient and the patient is asked to relax. The level of the mercury noted when the first sound is heard is equal to the maximum blood pressure or the systolic blood pressure. The level of the mercury noted when the blood flow sounds are heard normally is equal to the minimum blood pressure or diastolic blood pressure. Your role while measuring blood pressure. As a hospital assistant, you must ensure that the patient is relaxed and positioned on the bed. Arrange the equipment needed for measuring the blood pressure. Hand over the equipment to the doctor as and when asked.